Savne Jai Shri Krishna, Jai Chinendra, Jai Swaminarayan, Sairam, and good evening to you all. Good evening, everyone, and a very warm welcome to you all. On behalf of GAA London, I would like to thank you for joining us for today's Community Health Webinar. We are delighted to see so many participants joining us this evening to learn and share in this important conversation. Today's topic is let's talk about menopause. Menopause is a natural stage of life for women, yet it is often not openly discussed or fully understood within our communities. Many women experience physical, emotional, and hormonal changes during this time, and having the right information and support can make a significant difference to their well-being. As a community organization, GAA London believes it is important to create space where we can talk openly about health, raise awareness, and support one another through knowledge and understanding. We're therefore very pleased to have Dr. Uma Marti with us this evening. Dr. Marti has worked as a gynecologist for 15 years and now practices as a GP, bringing with her extensive experience in women's health. She has also been actively supporting women in the community through specialist clinics, helping many navigate different ages of their health journey. During today's session, Dr. Marti will guide us through several important aspects of menopause, including what is menopause is, why it is important for us to understand it, how female hormones influence our physical, mental, and sexual health. There will also be an opportunity for questions and answers at the end of the session. We encourage everyone to listen, learn, and feel free to participate. Conversations like these help us build awareness, confidence, and support within our community. Without further delay, it is my pleasure to invite Umaji to begin the session. Thank you, and over to you, Umaji. Welcome back. Lovely to see you, and all yours. The stage is all yours.
Thank you very much for this opportunity. I was a gynecologist for many years, and then I became a GP with a special interest in gynecology. My aim in life is women are so, tolerant. They have so many things they want to please husband, in-laws, children, parents, everyone, and they forget about themselves. That is the thing about the women, not just in Indian community or anything. All over the world, the women are same. Okay, because I work with women from different countries, different ethnic backgrounds. This is what I see. And I deal with a lot of problems, especially with the pain in women's. I think Kamlesh ji must have shared the YouTube, the release, why women should suffer with painful periods. That's one thing. But today's topic is totally different. It's about menopause. So let me share my screen. I try to, because I do a lot of guest lectures, but I do them for nurses, doctors. Of course, I do for the public as well. So I tried to, I removed all the, the medical language and try to put the simple language. But if you have any doubts at any time, please feel free to ask me any questions. Okay. Let me share my screen. Share. Can you see this, my screen?
Yes, we can. You need to.
From the beginning. Yeah.
Yes.
Okay. That's good. Let's start. Okay. Okay. Yes. So, what is menopause? Okay, everybody says we all know that, parents, moms, grandmothers, and everything. Usually, in a healthy woman, after the age of 45 years, usually not had a period for more than 12 months. Periods, rugaya, they say, or stopped. After 12 months, then we call menopause. In America, they take only 6 months. But in England and almost all over the world, if a woman didn't have a period for 12 months, we'll say she has gone through a change or menopause. If you look at the life expectancy at birth for women has gone up over the years. Like the ancestors, they were not living so long, but now women are living so long. So even like 90-year-olds and 100-year-old, I have a patient who is 98. She comes to my clinic walking, and 92-year-old still comes on a bike. Can you believe that? So like that, the things have changed. So more women are going to spend half of their life actually. If the expectancy is gone, they will be in this menopause stage. In some cases, in some women, in some families, or when the women have some medical problems, the periods stop at the age before 40 years. So normal age of menopause in UK is about 51.5 years. Okay. But if the period stop before, like, not having a period for 12 months, under 40 years, okay, not on any hormones, not pregnant, anything, nothing happens, just period stop before the age of 40, then we call it as premature menopause. Okay, let's talk more about it. Why is it important? Why is menopause important? So 8 out of 10 women, this if some of you must have gone through menopause and you must have experienced the hot flushes, okay, and they cannot take the menopause and their sleepless nights, hot flushes and all. But the more than that, it is more important that because of the lack of the hormone, the bones become thin. So there's a high risk of fractures. Vertebral fractures are very common. Hip fractures are common, 1 in 5. And you see so many women, elderly women, the most common cause of them going to a hospital at certain is a fracture of a hip, a fracture of a vertebral fractures, back pain because of vertebral fracture. And also, most women after the menopause, they're more risk of cancers. And also, the other important part why menopause is important is the bladder problems, incontinence problems, and the uterus coming down, like prolapse, we call it. Okay, Bachadan, Baharai, like that. I get patients like that. I work in Rochdale, so I don't know much. I can't speak very good Hindi because I should. I can understand very well, but I can't speak very good. I come from South India. Now everyone in Andhra Pradesh, they can speak very good Hindi. But in my days, we didn't have Hindi as a language, which is not very good. So my mother tongue is Telugu, and of course, here we speak the common language English. So what I'm going to tell you is these are so many changes happen in the body. Okay. So that is why it is very, very important. So it is bodily important, but the risk of fractures, that is scary. And then the risk of the cancer, everything will increase after menopause. And everything you all know about it. Oh no, we can't have hormones. HRT can double the risk of breast cancer, blah, blah, blah. HRT is horrible. And you must have seen in papers, everything. The main thing today, I'm just going to talk not just what is menopause, and why can't we have HRT? What about hormone replacement therapy? How it helps women? That is another thing I'm going to cover today. So if you just all these problems, this is in the, but what happened was finally they said HRT is not a danger to women. It is not a danger to women. And after this has come, the NICE guide. See, another important thing that the doctors is we all follow what are called NICE guidelines, National Institute of Clinical Excellence. They produce guidelines. HRT, you should give hormone replacement therapy for women, but still women were not taking. But what made the women to think about menopause is this Channel 4 program. You all must have heard about this, the Venus program. And you won't believe after this program, there's a peak rise in HRT. The awareness has gone up. And more women want to know about menopause. They want to have hormone replacement therapy. They're not scared of hormones now. So that changed everything. Okay. You just, this is all simple. I'm just going to tell you. And I think most of you I know you all are non-medical, but just simple words. We all know there's a brain for the top of this, and the brain controls all the hormones in the body. In the brain, we've called it as pituitary. You must have heard there's a small gland called pituitary. it produces two hormones, okay? And these hormones, they act on the ovary. And the ovary, this is how the uterus, the womb looks like this, and there are two ovaries on either side. These are the two ovaries and the tube, okay? So this is to give a big better picture. I just want to show you, this is the ovary, a small white thing. This is the one which releases egg. When the egg is released, the woman can become pregnant. So this is the ovary which produces the hormone. Most important hormone for the body is estrogen. Okay, this is the hormone, the ovary. How is it produced? It is produced by the stimulation of the two hormones from the brain, from the pituitary. But the ovary also produces, if you take a cycle of a normal woman, young woman, she started her periods. Every month she was having periods. Why is she having periods? What happens is the first 14 days, the ovary produces estrogen. Okay. And after, in the middle of the cycle, the egg is released. Once the egg is released, the ovary produces another hormone called progesterone. You need not know the names of it, but estrogen is very important, and the progesterone is very important because it prepares the bed for the baby. So if the woman is not sexually active, or she's not planning any pregnancy, then she'll have a period. That's what happens every month. So these two hormones are very, very important. They both work on the uterus. What we need is only estrogen. Okay. But if a woman has a uterus, you can't, after menopause, what happens is the ovary stops producing every hormone. You'll be surprised to know ovary also produces a small amount of male hormone, that is testosterone. All women have some amount of male hormone that actually causes the libido, the sexual desire. That is because of the testosterone. So main hormones are these two. Okay, this is just the idea. What happens when the estrogen, the hormone, works from top to toe on our body? So when there is no estrogen, the hair becomes thin, and then women get the bones become thin, the breast drops, all the things. I need not tell you what happens. Many of you are already gone through menopause, and all the skin becomes very thin, and everything changes. So many changes happen. Another important thing is the vagina becomes very dry, so that causes pain with intercourse. So all these changes happen because everything is dependent on estrogen. Okay. From, as I said, from top to toe, the whole body is dependent on estrogen. So after we all are born, when we are born with only limited number of ovary in eggs. After all the eggs are released, after everything is done, all the cycles finish, then the ovary doesn't produce any more hormones. So we all are born with a fixed one, and it will. So all these changes happen because everything is dependent on estrogen. Can you see this? Can you? Oh, it's coming as a thing. So what happens? Symptoms of menopause. So these are the symptoms. When a woman goes through a change, what happens is she starts complaining of hot flushes. She becomes very irritable, and usually the partner and children, they recognize what's going with you. He can say, "Mom, what's happening? You're not very tolerant nowadays." So that is irritability, and the workplace as well, and you feel horrible. And some people say brain fog. The brain is not working. I don't remember anything. I used to be very good remembering names and everything. I open the fridge 101 times. I don't remember what do I want, and all the memory lapses. And then this osteoporosis, you won't know, but that is also happens in the bones, thinning of the bones. And very tired, they can't sleep in the night, they have this sudden feeling of hot flush, and then sweating and everything. So these are the symptoms when there is no estrogen. Another important thing is people think, "Oh, I don't want to take any hormones, I can put on weight." Okay. But then normally the women body is like in the shape of a pear. When the estrogen is not there, what happens is all the fat accumulates in the abdomen. So it becomes like an apple. So this is what they say. The women, the structure of the women should be like a pear, because the abdominal obesity is the cause, especially in Asians. If the abdominal obesity increases, risk of diabetes, risk of heart diseases, and everything. And so this is likely to happen in menopause as well. because this shape of the women changes. The abdominal fat distribution changes because of lack of hormone. So as I mentioned to you already, the fat distribution changes, skin becomes thin, bones become thin, muscles also lose the tone, and then heart also, like the cardiovascular, the blood vessels are much stronger in women as long as the estrogen is there. Cognitive function, all your memory function and everything. And cholesterol also changes. Sometimes we have a good cholesterol and a bad cholesterol. In menopause, what happens is the bad cholesterol goes up and the good cholesterol goes down. And there's another increased triglycerides. There also increase the risk of heart problems. So all these changes happen because of the lack of estrogen. So this is a thing, if I plan just right, the hot flush can be so bad. This is how a woman can describe. Can be just for a joke, I kept it. So intense feeling of heat. Suddenly the face becomes red. Flushing happens, sleep disturbance, all this happens, okay? So another important thing, as I said already, hot flushes, psychological symptoms, local symptoms are very important. The people get irritation below, down below, I have a problem, I have irritation, I feel very dry there. And I keep going to the toilet. When I pass urine, when I come back, I still have the sensation I have to go back. And having problems, I think I have a water infection. I have a water. Why women get water infection after menopause? Because the lining, where the tube, the urine passes, the bottom lining of the urethra, we call it, that is also hormone dependent. It becomes very thin. When everything becomes very thin, what happens is the bacteria from the back passage can come easily and can enter the bladder. So that causes the symptoms. Of course, libido and all this. Okay, I think I've told you enough of the process, but the sexual health is also very important. But what happens is decreased estrogen causes, the desire. That's a normal thing. But after a certain age, because of the lack of the hormones, they lose interest in having a normal sexual life. That causes relationship problems. And also, not only that, once a woman has, because the vagina is so dry, when she has pain during intercourse, the brain says, no, no, you can't have it. It is painful. Simple treatment, making the vagina more moisturized, can make a better sexual life, can better. Same thing, sometimes, because I said the testosterone is also there, very important. So if the woman has a loss of libido, that means testosterone. Now we'll talk about whether we can give testosterone or not. And another, all this, she's tired, she has no mood, so she wants to avoid normal sexual life. That causes a lot of family problems, relationship problems, which is very, very common. So let me tell you something. When before all this started, because I'm in this profession for too long, I joined, become a gynecologist. I joined medical school in 81. I joined to become a gynecologist in 89. So from 1989, I'm in this profession. Okay, so I have seen sometimes they're saying estrogen best, estrogen not good, estrogen best. So over the years, I have actually seen so many changes in my life with HRT. So only 15% of women used to take HRT many, many years ago. People who had an early hysterectomy, ovaries removed, they used to take HRT. But things have changed. And most of the women, they go to all these herbal remedies. They spend a lot of money, a black cohosh, ginkgo biloba, this and this. Sometimes you have to be very careful. And these, especially the black cohosh, can affect your liver enzymes. They can interfere with your other medications. If you're taking some other medications, it may interfere like that. So all these are the herbal remedies, but the problem is they may not work as they should work. And also some say, oh, I want to eat soya. Soya has, how much soya you need? Phytoestrogen, you need plenty of soya to get a small amount of estrogen, okay? But estrogen is for estrogen. Women need estrogen. There are multiple reasons why people, previous doctors used to never prescribe, because so many theories, so much confusion data. Doctors also confused it so much. So they were not also, when the knowledge is scanty, as you know, theories are plenty, doctors are confused. And when women is to go, oh, no, I can't give you HRT. It is normal to go a natural process of menopause. You should go with it, That's what even doctors used to do. But things have changed now, okay? The guidelines have come, you should offer women hormone replacement therapy, at least for a short time. At least, for example, like 2 years or 5 years, you should give a hormone replacement therapy. You should give women for that. And basically, you should give women vaginal estrogens for women as long as they need. And also, you should not, when a woman comes with loss of libido, please consider testosterone. So these are the guidelines which are given in 2015 to doctors. Until now, the doctors are always scared. For example, I'm a GP, but obviously I'm a gynecologist as well. So my knowledge about HRT will be different than a normal GP, because I'm not an expert in other drugs like asthma, COPD. I'm not an expert, but some doctors, some GPs are experts in diabetes, COPD, asthma. But my specialty is gynecology, so I'm more confident than them. So that is why some of the GPs, they didn't want to do. But when the nice guidelines came, that actually eased the pressure of the doctors. Okay, yes, I can give. So then what happened? Suddenly, the HRT things have gone up. The prescriptions have gone up. Can you see how the prescriptions have gone up? Another reason is there. The other reason is, when I was in doing my post graduation, or even when I came to this country, we had only estrogen tablets, estrogen and progesterone hormone tablets. We used to have implants. After hysterectomy, we used to put implants under the skin. But things have changed now. Now the estrogen is available in the form of a patch, is available as a spray, it's available as a gel, it's available like anything. So people used to have, like when they used to have diabetes, oh no, the GP used to say, you have diabetes, you have hypertension, I can't give you hormones. But now transdermal, that has changed. The safety has gone up. So look at the prescriptions. The transdermal has gone up so much. See, can you see that how much it has gone up? So that is the beauty of the HRT now. So what do we do when you go and see your doctor? Usually they'll ask you about when did your period stop. They ask you about any medical problems you have. Are you on your heart diseases? Any history of clots like pulmonary embolism, DVT, deep vein thrombosis? Have you had a hysterectomy? Because when you have a hysterectomy, you don't need a progesterone. I told you, isn't it? The ovary produces two hormones, estrogen and progesterone. If a woman has uterus, she needs estrogen and progesterone. If a woman had a hysterectomy, she needs all estrogen. There is no why? The reason is, if a woman has a uterus, if she has all estrogen, the lining of the womb can become thick and it can cause uterine cancer. That is why when we give estrogen with a woman with a uterus, we have to give progesterone to protect the womb. If there is no uterus, there is no need for progesterone. You just need only one hormone. Okay. So all that history is very, very important. Okay. And also family history. Some people have a very strong family history of breast cancer. Some people have their genes, BRCA genes in the family. They can't have HRT. They have to have the expert opinion. They have to have the opinion if there's strong family history. The main history of the breast cancer is, if a woman herself had breast cancer, we don't give HRT. If you're women, there are other alternatives are there. If the woman family, if they say, oh, I have a family history of breast cancer, then we are usually asked her the history, how old your mother was at the time of the breast cancer, how many, like, what about your cousins, any gene is there. So that history is very important for us. If they say, oh, my maternal aunt, sister had breast cancer, but no one else, then that history is not very important. Mother, maternal, the sisters, all that history is very important. So the doctor will ask you all this history when you go for HRT. This is what I was telling you. Everybody thinks hormones, you put on weight. No, actually estrogen distributes the fat in such a way. Menopause, see, can you see that? Increased total body fat, abdominal fat increases. When there's no estrogen, menopausal women put on weight. And I'm sure we all know about it anyway. We all experience. The other concern is, people think, oh, I can get breast cancer. Okay. Normally, any woman after the age of 50, she is at risk of breast cancer. That is normal. Okay. Whether so the normally diagnosed 23, the risk of, if you take 1,000 women, 23 women can have breast cancer. That is normally. But it can increase. There is two types of hormones are there. It can increase to 4 times by combined HRT. I'll explain what is combined HRT. Okay. But the main risk I want to tell you is not the hormones, it's the obesity. When the woman is when the woman is overweight, she's more at risk of breast cancer even than on the HRT. So if they also found that if the women have do a lifestyle management, at least 2.5 hours of moderate exercise per week, the breast cancer is less, 7 fewer cases. And if the woman has estrogen alone, they say they're less cancer, but we'll talk more about it. Smoking, alcohol, overweight, they all increase the risk of breast cancer in general. So not just the hormones, it is not the hormones, it's the overweight, which is more dangerous. So, and also, what about heart attacks? Oh my God, people may think, oh, I may die of heart attack if I take it. No, it does not increase the risk of heart attacks, okay? Does not affect, but we have to see. But if people, sometimes they can have the hypertension or they may have mild angina or anything, the doctor will assess, but they cannot have oral HRT tablets, but they can have gel spray or patch, okay? And next one is, where is my next? Yeah, addressing concern. This is very important. This is, as I already said, oh, I have diabetes, can I have thromboembolism, can I have all these questions, all these things, the GP will be able to answer your questions if you have any doubts before prescribing HRT. Okay, and why should I take HRT? If you have any symptoms like hot flushes and all, it will help you. If you have low mood, it will help you. And sexual difficulties, it will help you. And main thing is vaginal symptoms, dry vagina, water infections will be better. And also, most other important thing is osteoporosis. And, as I already said, fractures are very, very common in women. Okay. What is the right choice? What suits me? That is the problem. Okay. Every woman is different. You can't say just because Mrs. Gupta uses tablets, and Mrs. Smith can't use tablets. She has some other problem. Very good, like Radha Ben may use something, and Seema Ben may not use a different thing. So each and everyone is different because she's using. I use that. No, it is tailored. Like how we have the blouses, one may not fit to the other one, so it should be tailored for us like that. Okay. Then, as I already mentioned to you, when there is no uterus, women without any uterus, they must have had hysterectomy for heavy periods, or they must have had a hysterectomy for heavy periods before, or they must have had a hysterectomy for fibroids, something or other. So, am I running the late? Can you give me a few more minutes?
Yes, sure.
Okay. So we are coming to the thing, I'll be as quick as possible. Okay. So if the women had a no uterus, so naturally she needs only estrogen. Okay. Then estrogen, as I said, it can be given in the form of tablets or patches. It can be used different patches are there. And then this is how the gel is. It is how you use. And then you have the spray. This is the spray you can use. All this happens, all this diagnosis. So basically, if the woman has no uterus, it's very easy to. If the woman has a uterus, we usually ask, when did your period stop? If the women periods last period was less than 1 year, we give a hormone therapy so that the women have a period. We mimic the natural cycle. If the women say, oh, my period stopped about 18 months, doctor, then I will give her a HRT without causing any periods. So this is a variety is there. I'm just showing you this diagram. Looks very technical for you, but what I'm trying to say is, see, we have various preparations and we have various combinations as well. So sequential HRT means if a woman just stopped period 6 months ago, okay, and suffering with all the symptoms, then we give tablets like, can you see the different colors? So then the woman will have a period. Okay, so we have to give them a period. So these are the patches as well. All these will cause periods for women. And another important thing is, oh my God, this is the best. Women, if she has heavy periods or she wants to, because I said if she has a uterus, if she has a hormone coil, that's it. Once she has the hormonal coil, for 5 years, the uterus is protected. She can have pad, gel, anything she can have, but the uterus is totally protected when she has the Mirena coil. This hormone coil has progesterone. It will protect you from not having cancer. It will protect the lining of the womb so that you can happily have the estrogen. But it works only for 5 years. You have to get it changed. So the woman is, the uterus is there, but her periods was more than 1 year. Then we give the tablets or patches everything, whatever we give, see, each tablet has estrogen and progesterone. Before you have seen a colorful tablet here, you have seen a colorful tablet here. But if you see this one, each tablet has estrogen and progesterone. So the woman takes one tablet every day, estrogen and progesterone tablet. She won't have a period. And she can have it with all these combinations she can have. So basically what happens is Conti. Have you seen the Conti? So that is the thing where the woman doesn't have the periods. Okay. And if women cannot have, she had a breast cancer, she cannot have HRT. Then there are other things like we use antidepressants, which can help to prevent the symptoms. So don't hesitate to speak to your doctor. They'll be able to help you even if someone had a breast cancer. So all these are the various combinations, that is what I'm just trying. So if women say, oh, I'm overweight, can I have HRT? Yes, you can have HRT, but you can't have oral HRT. You can have a hormonal HRT. It's okay. So another important thing is if a woman wants contraception, HRT is not a contraceptive. Believe me, it's not a contraceptive. So if you take HRT, except the coil I was telling you, it is, if you put a hormone coil, it's a contraceptive, it stops your periods, and it is a HRT. But otherwise, it's not a contraceptive. You have to use extra contraception. The doctor will speak to you. You have to speak to your doctor. This is loss of libido, the sexual desire. Can I have testosterone? Yes, I want testosterone. So, but you have to discuss first with your doctor. First, your dry vagina should be treated. All the symptoms should be treated. Because this product of testosterone is licensed in England only last year, August. Okay, before that it was not licensed, but still it's not available on NHS. Okay, this is what we give for. This is not a licensed product, but doctors like me, we can prescribe that. We prescribe that. So the next most important thing is dry vagina, which will take another minute, which is very, very important. Before going to the hormonal dry vagina, everything, I wanted to tell you about a good diet and exercise are very, very important for this. Okay, local symptoms, vaginal discharge, itching, all these problems, they all can be treated. See, the vagina will be like this with rugosities, but it becomes very thin with menopause. So that it's thick layer. Can you see? There's a healthy thick layer when a young woman, but it becomes so thin. That is where women have problems as well. And the vagina and the urethra also become very thin. So what do we do? See, this is how it looks. So what do we do? So this is how see, look at the bladder is so close. So when everything becomes thin, the bacteria from the back passage can come to the bladder easily. They get infections. Okay, so we give all these types of creams are there. So please don't hesitate to ask for vaginal estrogen. They don't get absorbed. They don't cause breast cancer. Unless the woman had breast cancer, we can happily give vaginal estrogen. We usually give initially for 2 weeks every day. And after that, we give them twice a week forever and ever. They can use it forever and ever. If the woman doesn't want for sexual things, she can have lubricants. These are lots of lubricants available. So this is what we did in our practice. Women with water infections, we gave them all HR, local vaginal estrogen. It disappeared. See, can you see? 23 of them were happy. No, it did not come back again. Water infection. So this is the fear. My thing is done, finished. I want to tell you not to be afraid of HRT, and please feel free, especially using the vaginal estrogen, which is very, very important. Okay. So this is my thing. Thank you very much. And I'd say that estrogen, if you want a holistic care, estrogens are very important. Thank you. Thank you very much. I'm very happy to take any questions.
Anybody from the participants who would like to question Umaji? Please raise your hand on the side, or any questions in the chat box.
Feel free, please feel free. This is for you. I'm doing this. I can understand about everything, and please feel free. I'll just stop share. Shall I stop share my presentation?
Yes, please.
Yeah. So then I
Thank
can
you.
Okay. So feel free to talk. And this is a forum. I'm very pleased to know that you have this forum, so that it's a very educational forum you're having. So please kindly this.
Any questions from the chat box?
there'll be two reasons. One is either that they didn't understand,
Or
or
you're too fast.
am I too fast?
To me, it was fine, but let's see what the participants say.
No, if you think I'm too
A
fast,
bit
I can
fast.
repeat what you missed it.
It was a little bit fast.
Oh, I'm so sorry. I'm so sorry. What I'm trying to say is the whole presentation is, if a woman has menopausal symptoms, she should not hesitate to go and discuss with her doctor that she wants hormones. Okay. And whether you are suitable or not for the hormones, the GP will be able to assess you. One important thing is, the other important point is using vaginal estrogens. Vaginal estrogen is available in the form of vaginal estrogen tablets or vaginal estrogen cream. You can happily use it because it doesn't get absorbed. So the side effects and all, you should not worry, I may get this, I may get that. But vaginal estrogen improves the lubrication of the vagina. It actually not only for sexual function, it also prevents you from having water infections. So that is it. Okay. Normally, any other point, if you haven't understood, if I was quick, I'm really sorry. Basically, and what I'm trying to say is, people think, another misnomer people think is, if you take HRT, you put on weight. But whether I was speaking loud or too fast, you have seen the picture of a pear and an apple. With menopause, what happens is the distribution of the fat changes. Okay. So that is another thing.
Talking about HRT, how do hormonal changes during menopause affect a woman's physical health?
Yes, very good question. The physical health is basically she feels very tired.
Mm.
She becomes depressed. That is not a physical thing, of course, mental thing. And muscle aches, body aches, joints pain, backache, all the symptoms. And also she can't sleep very well with these symptoms. If she doesn't sleep in the night, she'll be very tired. She has to get up in the morning, do her cooking, go to the office. So that is also the affects a lot of. So all the symptoms of the lack of estrogen will affect physical symptoms, and naturally it affects mental symptoms. She feels more depressed. I used to finish the job in just 30 minutes. Now I'm taking 2 hours or taking 1 hour, and then
Exhausted.
exhausted. My
Yeah.
my muscles hurt all the time. All that happens because of lack of
Mm.
estrogen.
So, for the participants' sakes, many women experience hot flushes, sleep disturbance, or fatigue, as we've just talked. Um, what causes these symptoms and how can they be managed?
Yeah, very good question. Because that is why I've drawn the diagram. When there is no estrogen, there is a part in the brain which is called as a thermoregulatory center, which regulates the temperature of the body. That doesn't work properly. When it doesn't work properly, because of the lack of estrogen, the woman gets that hot flush. The
Mm.
whole body becomes warm and the sweating comes. And what is the treatment for that is that most ideally, estrogen clears it like anything, hormones. If the woman doesn't want to take estrogen, there are other tablets. Like some people get, there's some people think, oh, I don't want to use antidepressants. But some antidepressants, they help with hot flushes, sertraline, citalopram, and some of the things like venlafaxine. They are antidepressants and they stop the hot flushes.
Mm. Yeah.
Please feel free to talk. I'm really sorry if I'm very fast.
It's okay. So, does menopause increase the risk of conditions such as osteoporosis or heart disease?
Yes,
They
yes.
do. Yeah.
Because what happens is estrogen, the collagen, the bone is made up of calcium,
Mm.
phosphate, and collagen. The way this binding is by collagen. The
Yeah.
collagen becomes very thin. You may be taking your calcium tablets, vitamin D tablets, but
Yeah.
the collagen is the binding thing that will be very thin when there is no estrogen. So naturally, as we get older, when there is no estrogen, our bones become very thin, especially if you have a family history of thin bones, it gets worse. Caucasians are more at risk than Asians. Africans have better bones than Asians, like that.
True. Yeah, yeah. So, in like mental and emotional health wise, how can menopause affect mental health, such as mood changes, anxiety, or memory?
Okay.
I know you've already spoken, but you're so fast.
Yeah, I'm so sorry. You should have
It's
stopped
okay.
me in the middle. I
It's
should
okay.
have.
So we can now explain.
Because I because I normally do the teaching for students, isn't
That's
it?
right. Yeah.
And my flow goes fast with that, and I used to speak much faster before. I've slowed down quite a lot. My language is Telugu, and we speak very fast, unfortunately. The
Amazing.
the hormone changes happen in the brain in so much, okay?
Yeah.
When the menopause, because the serotonin, there's a substance called serotonin in the brain which keeps our mood right. They found that those levels will drop as well in menopause. The estrogen, there's so much effect of the estrogen on the brain, the different parts of the brain. So when there is no estrogen, the memory part goes, the women slows down, and they say brain fog. You see someone, you forget their name, and
Mm,
you want to say something to someone, you forget about it.
true. True.
That is all that is called, people say it's brain fog.
It happened to me on Sunday, actually. I talk to this person every week, but when I went to introduce that person to someone, I'm trying to think now, what is her name? So it does happen. So, what practical steps can women take to maintain emotional well being during this stage of life?
Because apart from the hormones, everything we all talk about a good lifestyle. One is having a healthy eating, going for walks, things like yoga, meditation, having friends, good laugh, having hobbies.
Mm.
All that will help women. Staying lonely, that actually makes things worse as well. So if they can come out and make friends or go to some societies, I really appreciate that you have this forum, and very nice that people have come and then they're able to join online. Because some people don't want to travel. Since COVID, we all have this Zoom.
Yeah,
Using Zoom has gone up.
yeah,
Like that, that is the well-being of any woman after a certain age.
very
Everyone
true.
has problems, health problems, family problems, personal problems. But the thing is, the way we can do is keeping ourselves
Yeah.
busy, active, and that happens. I think there are some questions as well in the chat box. I'll be very happy to see.
Yes. So Mayuri is asking if someone who has undergone menopause, not taken special care, taking treatment for hot flushes and other relevant symptoms, can this affect postmenopausal health and well-being?
Hot flashes, they last only for a short time. Okay, in some people, only in about 15% of people, it can go for a long time. Okay,
Yeah, yeah.
so it is again individual thing. Some people, they manage their hot flashes without HRT. Okay, then they're okay. Each and every person is different. Okay, so if they had severe hot flashes, which has caused, you know, sleeplessness, that will have significant event. So if the hot flashes, they have already gone through the stage, they need not worry about it. If they are going through hot flashes, please get some help like that.
So she's also saying after normal period stops at onset of menopause, for how long can postmenopausal symptoms go on for?
Yeah, this is again thing. Most of the time, the symptoms go for about five, a maximum 5 years. First 2 years will be difficult, and some people, even at the age of 60, they'll be having menopausal symptoms. The
Mm,
percentage is very, very small. About 5 to 10% people, they still have hot flushes at the age of 60, even at the age of 65. So that the studies have shown that there are some outliners. People can still have like that. That is why if the women wants to have HRT, yeah, especially up to the age of 60, we are very liberal. We give them HRT. We definitely give them estrogen. As I said, we prefer them in the form of transdermal. Transdermal means through the skin we give them. Either it's a patch or a gel or a spray.
So, lifestyle and support, what role does hormone replacement therapy (HRT) play, and when should someone consider it?
It is, like as soon as they start the menopausal symptoms, they should go and discuss with their doctor. Because just
Mm.
now I've told you that from top to bottom, it has an effect on your body. Okay. So my presentation is mainly to give the message or educate women saying that please don't hesitate about the hormone replacement therapy, because they have done so much research. They say women can have hormone replacement therapy and the doctor will assess. If somebody cannot have for example, someone just had a heart attack, we don't give them HRT immediately. Like there are pros and cons, but most of the women will be eligible for hormone replacement therapy. And the doctor, so feel free to see your doctor and talk about hormone replacement.
Mm. Yeah. So my great question. I love these closing questions. What is the one key message you would like women and their families to take away from today's session?
One is the speaker is too fast, please don't take away that. Hopefully, I got the message like, probably in future, if I would choose a small topics to do for you, HRT and menopause is a very big topic. So that is why I wanted to give you everything. Okay. So that is, it is very, Kamlesh ji was asking me, can you do this? Can you do that? As I said, it can do. See, adding something else, already this is a big topic as well, so I may split and do a small topics. So
Sure.
first, don't take the message that the speaker is fast. So I will adjust myself to you. The most important thing is every woman should be happy. To be
Smiling,
happy, to be
smiling all the
happy
time.
is right. So to be happy, sometimes they need an extra things like in the like the hormones, not to hesitate to take hormones. Especially the vaginal hormones are very, very important so that they don't get water infections.
Mm.
So menopause is very common, and using talking about HRT should be more and more. We should more open up and talk
Yes.
about hormone replacement therapy. So we should not think it is dangerous, because the science has advanced so much. So you can have HRT through the skin. You can have, not by the tablets. Somebody may be on 16 tablets a day. They hate to have another tablet. That is.
Mm. Yeah. So we've now understood menopause, symptoms women often ignore, impact on health. How do hormonal changes during menopause how menopause affect a woman's overall health, physically, mentally, and even in terms of relationship and sexual well-being?
Yeah. So this is there is effect, as I said, from top to toe. The estrogen has a role.
Yeah. And then we've spoken about lifestyle and natural support. Are there lifestyle changes such as diet, exercise, yoga, or stress management that can help women manage menopause symptoms and more comfortably? So, we've also spoken about medical support. Many women hear about hormone replacement therapy, which is HRT, but may feel unsure or concerned about it. When should women consider medical advice or treatment options like HRT? So, seek your GP's help. Yeah. And my bonus question, if you need, what advice would you give to husbands, families, and the wider community so they can better support women going through menopause?
Yeah, because the man should understand every part of this. I don't know.
Absolutely.
Kamlesh ji has must have shared my video about pelvic pain. I want that to be seen as a partners together. Like let's have that everything. women, of course, they have their own things. Just like menopause, there is andropause as well. They have their testosterone thing and all. But in women, there are the hormonal effect will be much more. Unfortunately, I know right from the age of 50, 45, it starts working, and then they go down. So they have to encourage the women. Okay, first of all, if they have any sexual problems, they have to encourage. They should understand and encourage them to go and see a doctor. Encourage them to have a local vaginal estrogens and get some lubricants. The GPs will be able to prescribe lubricants. And also, that is one thing for the local symptom. The second symptom, if there are mood symptoms are there, the partner should encourage them to see a doctor. You go, why don't you go and see a doctor and speak to them? You will be surprised, when like most of in my clinics, most of them, they actually come with their partner. Okay, because the partner is worried about her and he brings her to my clinic.
Yeah.
Because I'm
There,
a
yeah.
menopause clinic. Yeah. Mm.
Thank you. There are questions on the chat now. Collagen supplements, are they good?
No, there is no evidence as such for the collagen supplements as such. The evidence is much poor. In Britain, we follow everything by evidence. Okay, so that's how I'm trained as well. So I cannot comment on herbal medications or collagen preparation, but they have not much thing. They say there are some people's a benefit, but there's no strong evidence. So
Yeah.
that is why it is not prescribed by GPs.
Mm. And how long, there's a question there, how long does it take for these HRT to work once you start taking them?
Yes, that's a very good question. If you take HRT, the first benefit you get is if you have hot flushes, it will be within a week or a couple of weeks you see. Okay.
Mm.
You should give you like a good 2 weeks. The first symptoms that are benefited are the vasomotor symptoms, hot flushes and sweating. Okay. The other effects, like for example, as I said, the effect on the osteoporosis and all is slow, but it works, keep working as well. Okay. So, and the mental symptoms, fog, brain fog, and everything, it takes usually about 3 to 4 weeks. The effect will be seen. But first, the foremost symptom they say they're getting benefit is the hot flushes and sleep as well. They sleep better.
Mm. So there's a question, is HRT suitable for 65-year-old who is postmenopausal since 45 years? Will it help with hair thinning and moods?
What happens is after the age of 60, the safety is studied. Okay. After the age of 60, we have to weigh the pros and cons. Okay. What are their medical background? What about their mammograms? How were they? Like that. So that is, but definitely age 65, 70, or anything, vaginal estrogen will work. Vaginal estrogen, local vaginal estrogen helps them to prevent water infections. In
Mm.
the women, I had the women at the age of 80 as well on hormone replacement therapy, but they were only on estrogen.
Mm.
Progesterone has some side effects. Okay. Like it also affects the breast. It also, because as you get older and older, your risk of breast cancer will increase. Okay. So that is why up to the age of 60, and also your blood vessels will become more thicker and thicker. Okay.
Yeah.
So
Yeah.
the up to 60, there's a good safe record. After 60, to give a systemic HRT, I don't say no, no, no to that, but they have to be specially assessed in a menopause clinic. A GP may not be able to prescribe. They have to attend a menopause clinic if they need. But a vaginal estrogen, she can use. A 90-year-old lady also use it. A 100-year-old lady is there for me in my clinic who uses vaginal estrogen.
Very good. Last question. Pulps were removed in 70s age range s- due to spotting and vaginal
Let me just,
gel was prescribed. How does this help?
what is it? I can't get it. Um,
I can't.
Olives were removed in 70s age
Yeah.
range due to spotting and vaginal gel was prescribed. How this? Yes, because if the polyps were removed, then it is okay. They can still use the vaginal estrogen.
Okay.
The spotting could be at that point they must have seen. When you I didn't talk about the bleeding after menopause. That is a big topic by itself. We can do that at some point. Okay, already it's quite a lot to cover. Some women, because when the vagina becomes very dry, they bleed, they have spotting. So we assess the women, which if there is no uterus at all, that we are not worried about it. Because having a bleeding after menopause, we will be worried about vaginal cancer, cervical cancer, and a uterine cancer.
Mm.
So if they have no uterus, then most of the time the vagina, the bleeding is coming from vagina because the vagina becomes very thin and atrophic. The quick fix is giving them vaginal estrogen. If they have a uterus, what we do is we do a scan and
Mm.
we measure the lining of the womb. If the womb lining is very thin, they can have vaginal estrogen. If the thickening of the lining is thick, more than 4 millimeters, they'll go straight to hospital as a 2 week wait because they need urgent hysteroscopy because to rule out cancer of the womb.
All right. Okay. Okay. Uh, Thank you very much. As we come to the end of today's webinar on behalf of GAA London, I would like to extend our sincere thanks to Umaji for sharing her knowledge and experience with us this evening. Menopause is a very important stage in a woman's life, yet it is often not spoken about openly. Today's session has helped us better understand the physical, emotional, and hormonal changes that may women experience, and more importantly, how awareness, support, and the right information can make a real difference. We are very grateful to Dr. Marti for taking the time to guide us through this topic and for answering our questions so clearly. Your insights will certainly help many people in our community. I would also like to thank everyone who joined us today and participated in this conversation by attending sessions like this and sharing the information with others. We help create more informed, supportive, and healthier community. Please do keep an eye out for future GAA London community webinars where we will continue to bring important health and well-being topics to our community. So once again, thank you, Dr. Marti, and thank you to all our participants for joining this evening. Have a wonderful evening, everyone, and namaste, shubharatri to you all. Thank you again, and we shall ask Umaji to join us again soon with a different topic.
More topics if you give me, then I'll be very soon.
Thank you. Thank you very much again. Take care and good night, all. Thank you.
Thank you very much, Doctor.
Thank you. Thank you.
Thank you.
Anybody else? Thank you all. Take care. Good night.